My name is Jessica Sturgis, and I'm doing a presentation over fetal alcohol syndrome. What is fetal alcohol syndrome? It is a condition that develops in a fetus, which is a developing baby, when a pregnant person consumes alcohol during pregnancy. It results from alcohol exposure during the mother's pregnancy and can cause brain damage and growth problems. The specific defects caused by FAS vary from child to child, but unfortunately, they are not reversible. If you or someone you know is pregnant, it's crucial to avoid alcohol consumption to prevent this serious condition. Preventions and interventions. Preventions. Fetal alcohol spectrum disorders are entirely preventable. Here are some essential strategies to avoid alcohol-related harm during pregnancy. Number 1. Zero alcohol consumption. Pregnant individuals should abstain from alcohol completely. No amount of alcohol has been proven safe during pregnancy, so it's crucial to stop drinking immediately if pregnancy is suspected. Number 2, concentration. If you are a sexually active female of childbearing age, use this to prevent unintended pregnancies while avoiding alcohol, which is also known as birth control. Number 3, educate others. Encourage pregnant friends and family members who drink to stop alcohol consumption during pregnancy. Interventions. Early interventions range from a large spectrum. Seeking professional help. Encourage early diagnosis and interventions. Consult with healthcare professionals and therapists and educators. Individualized plans. Work with specialists to create personalized plans for education, therapy, and social development. Structured environment. Consistent routines. Establish predictable routines to reduce anxiety and help the individual feel secure. Clear expectations. Set clear rules and expectations. Use visual cues if needed. Social skills development. Social training. Teach social skills, appropriate behavior, and communication techniques. Role playing. Practice social scenarios through role playing. Number 5, emotional support. Be patient. Understand that individuals with FAS may struggle with emotions. Offer patience and reassurance. Positive reinforcements, praise achievements and efforts, encourage self-esteem. Advocate for accommodations. School and work. Advocate for accommodations in individual educational settings and workplaces. Individualized education plans, IEPs, can be helpful. Legal system. If necessary, advocate for legal accommodations and understanding within the legal system. Avoid alcohol exposure in all. Model behavior if you're a caregiver. Avoid alcohol during pregnancy to set a positive example. Support pregnant individuals. Encourage pregnant friends and family members to abstain from alcohol. Common appearances. It is important to know not all children will have the same side effects, especially with their appearance. They could have the learning and developmental delays along with that. Fetal alcohol syndrome is common to have a small head with small eye opening and low nasal bridges, with a flat midface and a smooth cupid's bow with a thin upper lip. However, this is not apparent in all cases. Treatments. Medications. They can stimulate the lack of focus or hyperactivity. Some drugs may help with anxiety, just like clozapine. Anti-anxiety drugs along with this can be used to treat the anxiety that they are experiencing. Therapy. Speech and physical therapy. These therapies assist children in developing normal speech and physical abilities. Physical therapy helps children lead a more independent life. Specialist. Psychiatrists. These experts specialize in diagnosing and treating mental illnesses. Fetal alcohol syndrome long-term effects. FAS can have significant long-term effects on individuals. Here are some key points. Number 1, physical and medical issues. Growth deficiencies. Individuals with FAS may experience stunted height or weight, distinctive facial features. These can include a thin upper lip or a flattened Cupid's bow. Organ damage. FAS can affect the heart, kidneys, and liver. Number 2, brain and cognitive effects. Brain damage, alcohol exposure during pregnancy can lead to permanent brain damage. Intelligent disabilities. Children with FAS often have learning disabilities or difficulties with cognitive impairments. Behavioral challenges. These may include attention deficit hyperactivity disorder, ADHD, aggression, and poor judgment. Emotional and mental issues, anxiety, depression, and low self-esteem are common. Number 3, social and functional impacts. Difficulty living independently. People with FAS may struggle with independent living due to their cognitive behavioral challenges. Legal troubles. FAS increases the likelihood of legal issues. Higher risk of suicide. Individuals with FAS face an elevated risk of suicide. It's crucial to recognize the FAS is preventable. Pregnant individuals should avoid alcohol consumption to protect their developing babies from these long life consequences. Living fulfilling life with FAS. Number 1, individual versatility. Number 2, early interventions. Number 3, structured environment. Number 4, education and employment. Number 5, social relations and avoiding alcohol at all costs. A person with FAS faces unique challenges, but with appropriate support and understanding, they can lead a fulfilling life. Where can I find more information? Further information over FAS, it's very important to see the CDC guidelines. Getting help with the understanding. Several different schools and public brochures are put yearly on there for people to understand why to avoid alcohol. And for parents that are struggling, Kids Health is one of the best websites to look at all this information. And here are some of our references. My facts from CDC, causes and symptoms from Mayo Clinic, and then treatments from WebMD. This is my overall view. Thank you for listening.